Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, we always love doctors, and doctors come in all sorts of specialties, as we know. You know, we have orthopedic surgeons, we have plastic surgeons, we have dermatologists, but cardiologists are really, especially for this month, because this is Have a Better Heart Month, I always call it, you know, and so I'm so glad that that our guest today, Dr. It's Danish
Sheikh.
Right, Danish Sheikh.
Mm-hmm.
So even though I say Danish, it's Danish.
It's spelled the same way as Danish,
okay.
Yeah.
But it's Danish.
Mm-hmm, that's
Danish Sheikh.
That's right.
I got it, right?
Mm-hmm.
Okay, Danish Sheikh, Dr. Sheikh.
That's right.
Okay, so you're at Broward Health North, which is a really fantastic hospital. You know that.
Oh, yeah. I've been there for now approaching 2 years. Love it. It's great.
And tell me why you chose to be a cardiologist. I always ask all the specialists why.
Well, you know, cardiology in my family, the family history that I have is a really, really big family history of heart disease. I've always been fascinated about the way things work. Back in college, I wanted to do psych because psychology was the study of, you know, the mind and how people think and why people do what they do. Then I wanted to become a physician to understand how the body worked, and then I wanted to understand why my family suffers from heart disease, so I studied cardiology. And it's a joke, but I kind of wanted to understand the things that affected my family to become the family physician. I have a big passion for it, and I love it. And it's been a drive that I have to help not just my family, but the community, and teach people what I know.
Did they listen to you when you found out? My son's going to tell me what to do.
Yeah, it's actually funny. I remember having a conversation with my uncle. He has a really bad heart history, heart failure, cardiomyopathy. He's got a defibrillator. He's been in heart failure in and out of the hospital a few times. I remember talking to him and letting him know about the medications. We had a 2-3 hour conversation about stuff. And at the end of the day, he's like, oh, what do you know? You're just a kid. So one of the things that I realized is that even no matter how much school I'll go to, in my family's eyes, I'm still the little boy. So it's sweet, but he's doing a lot better. He's taken some advice, and he's doing great.
Let's talk about that advice, because I shared this with Dr. Sheikh, and I also just recently got on blood pressure medication, even though I feel fine. I didn't know anything, but your numbers are too high. Okay, so I asked him before the show, all right, well, aren't there foods and aren't there things I can do that will lower it and I don't have to take the medication anymore?
Well, you know, that's a very good question. So the way I kind of go about doing things is preventative care. What can we do now to prevent issues in the future? So when you're young and healthy, they recommend diet and exercise, even as we get older, but especially when you're young and healthy, continue diet and exercise, because that is going to postpone or at least decrease the risk of, let's say, high blood pressure, high cholesterol, things like that. Diet and exercise are still able to reverse the hypertension. And there have been some patients of mine that I've been able to get off of medications with diet and exercise, but not necessarily the fad diets, or the fad exercises. It's got to be what the American Heart Association recommend, American College of Cardiology. That's going to be about 30 minutes, 3 times a week of high intensity workout. That's going to be exercises that make you sweat, exercises that's going to make your heart race. Not necessarily being outside and letting the hot sun make you sweat, but something that's making your heart pump. And as far as the diet that they recommend a Mediterranean diet. So that's going to be your fish, your nuts, your salads, and things like that. Those things have shown to kind of decrease the risk of high blood pressure, coronary artery disease, and things like that. Parts of it are reversible. However, unfortunately, with family history and as we do get older, the blood pressure does become an issue. No matter how much exercise or diet you might do, sometimes your blood pressure might still be high. The medications that they provide is for us to prevent other complications for high blood pressure. For example, stroke, heart disease, things like that. So by getting those numbers under better control, whichever means we're able to get those numbers in, is going to help us in the future. The one thing about blood pressure, and something that a lot of patients complain about, is I don't understand what's wrong with it. I don't feel it. My blood pressure is high, but I don't feel it. Why do I have to take medications?
They all say that?
Yeah, and it makes sense. It makes sense, but
so it's a silent killer.
That's exactly right. That's why it's a silent killer, because of the stroke. And once you have a stroke, I mean, that's bad news. That's high mortality, or it could increase your risk of a heart attack. And by taking the medications, lifestyle modification, those things would help decrease the blood pressure, and then also decrease, hopefully, your risk of coronary artery disease or a stroke.
So there are many supplements that people know by, CoQ10 and all sorts of things. So people can still take the supplements in addition to their into their medication, as long as they tell you, right? As long as your patients explain.
Sure, there are certain supplements. So the thing with supplements and the medications that are prescribed is, of course, there are great supplements, multivitamins, folic acid, things like that. There are certain supplements that just studies haven't been done on. These over-the-counter medications are not necessarily FDA regulated. They're not FDA approved. The medications that doctors prescribe or your physician prescribes, those have been studied and researched and tested to make sure that we know what the side effects are. We know what the complications are. So it's difficult to, not all medications have been studied over the counter. That's why we're able to say, hey, take this medication rather than something over the counter, because we know it works. But there are certain supplements, yes, of course, you can take over the counter. That might be good for you. Yeah.
Well, let's talk about the eating. Now, that's something everybody can do.
Yeah.
Do you know that I have it's like a passion for sardines?
Oh, really?
And I know that sardines are good, right? Good for you.
Yeah, I mean, the sardines, so here's the thing.
In olive oil.
In olive oil, yeah.
That's what I do.
So the thing is, anything that's canned has a higher dose, or has preservatives, has a higher dose of sodium. High salt means higher blood pressure. So you have to be kind of careful about the salt content in those things. So canned foods, the bottled foods, or even like, say, TV dinners have a higher dose of sodium in them.
Yeah, I'm very careful. I don't do any of that, but I didn't even think about sardines as having a lot of sodium. So I should look and see that.
Yeah, take a look in the back of the label.
Otherwise I have to get fresh. I don't know anyone sells fresh sardines here.
Yeah, no, neither do I. But it's just something that you can take a look at in the back and see what the daily value and how much the percentage is, and kind of have an idea of how much salt there is there.
So how much salt should one have?
Cardiac patients, we recommend about 2 grams of salt a day, plus or minus. But also making sure that you stay hydrated, things like that, if you do take a lot of salt in. But with patients who have high blood pressure or congestive heart failure, you have to be very careful with salt, because salt, not only does it increase your blood pressure, but it'll, in patients who do have congestive heart failure, it retains fluid. So patients who are prone to have heart failure will have an increased risk of developing fluid overload, which causes them to have a shortness of breath and go into acute heart failure if they have a high salt diet. So that's why we recommend low salt diets for those type of patients as well.
Right, so if you can have a no salt diet, you're better off, but that's probably not possible. But because I just recently found out that bread has salt in it.
You know what?
Didn't know that.
It's very difficult to cut things out of your diet. My whole philosophy is this, is that everything in moderation. And make sure you watch what you eat. I'm guilty of eating fast food and junk food.
Well, you're so thin, and I mean, you don't have a problem with
Well,
anything.
I appreciate that, but at the same time, the things that I try to practice what I preach. So I might have a cheat day, but at the same time, I'll try to eat a healthier lifestyle. I'll try to go to the gym when I can make time out for it. But the reason I'm doing that is so that when I do get older, knowing, especially like I mentioned before, my family history, I might not be able to completely remove my history of heart disease or anything like that, but I can decrease that risk. I can postpone something that may happen in the future later rather than sooner.
And so you're a cardiologist, but you're not a cardiovascular surgeon.
That's right, yeah.
But I'm sure you know them, because you may have to then refer some of your patients. Well, why don't you talk about that? How does that work when someone you see that they're just not doing well?
Sure, yeah. So basically the way things work is you have a primary care physician. primary care physician is kind of the center of the web. They have an expertise of everything. And let's say their patient or whoever it may be says, hey, listen, you know, I'm having, let's say, chest pain. Something wrong, I don't know, or maybe I have high cholesterol, high blood pressure. The primary care will then refer them to go see a cardiologist. That's me. I'll do some further studies. Okay, that's when I'll do the stress test or an echocardiogram or just some blood work and maybe check the blood pressures or an EKG and all those things. And based off of those results, you know, if it's something that we can manage medically, we can do that. If you need to see a specialist, let's say there's I order a stress test, and the stress test shows that you might have a blockage in your heart, which could be causing your chest pain. I'll have you see an interventional cardiologist. Those are the doctors that will go in and fix those blockages, preventing or treating heart attacks. If you're having an arrhythmia, an irregular heartbeat, or anything that would get me concerned about a weak heart, I would have you see the electrophysiologist. That's the expert in the electrical activity of the heart. So if the interventional cardiologist is the plumber of the heart world, the electrophysiologist would be the electrician of the heart world. And then you had the vascular surgeon. The vascular surgeon is going to be doing a few things. So there's cardiovascular surgery. That's a very broad topic. So that's going to be doctors who do your bypasses, your open heart surgeries. They also do heart valve surgeries. They also do peripheral vascular disease, so diseases that you might have or blockages that you might have in your carotid arteries or in your legs, not just in your heart, might be treated with those doctors as well, if, for example, medications don't work.
Okay, so now I'm going to put you to the test.
Uh-oh.
No, it's all right. With all the new technology that's coming, what do you think is going to happen to the whole field of, well, just not cardiology, but the heart?
Sure.
I mean, we're going to be having, I mean, here you see, and I know it's not true for hearts, but if you go and you can now have a 3D build something, you can build parts. What do you think is going to happen with the heart and all these, and the carotids and the veins and the arteries? Do you think there's going to be something very new and exciting coming out?
Absolutely. I mean, there's new and exciting things being released all the time. Even within my training, there have been about 5 different things that have just popped up, whether it be medications to reduce your mortality and heart failure, whether it be new devices that go into your heart if you're not a candidate for blood thinners. There's a special device, for example, a Watchman device. A lot of elderly patients who are not candidates for blood thinners, if they have atrial fibrillation for stroke prevention, you know, before you kind of just would have to stop the blood thinners on these patients. Now you can actually put a device in their heart to prevent them from having a stroke in patients who are not candidates for blood thinners. That's been coming out. There's a new mitral valve surgery that's less invasive called mitral clipping. There's an aortic valve replacement, which we do at Broward General, called TAVR, which is for patients who need a new heart valve who are not candidates for surgery. So they didn't, instead of opening them up and doing an aggressive valve replacement, they actually go through the femoral artery up into the heart and put a new valve through the heart. And those valves are very common, very common. We do that a lot at Broward General. And the mitral clipping is coming up at Broward General as well, along with the mitral clipping. Or excuse me, the Watchman actually is already being done at Broward
How did
General
I
as
know
well.
that I could ask you that and you would have an answer? I just knew it. You
I
have
mean-
the sparkling eyes that I know you're just bright, you're just blinking, and it would be great. That was a wonderful explanation, because
I appreciate that.
I have seen, such an overhaul of a lot of these specialties, all sorts of things that have happened, and now with the brain surgery, there's so much. But so in your field of cardiology, are there candidates? I mean, if they go first to see you and you start them on a low dose, and then you watch them, and then do you give them an actual diet that you think? I mean, you say very casually, well, it's the Mediterranean diet, but a lot of people don't know what that is.
The word doctor means teacher. And so I'm there to teach them about their bodies, about their issues, and try to explain why is it that they are taking their medication? What is the purpose of their medication? What is the purpose of exercise? What is the purpose of their diet? How does that affect them? It takes a little bit of time, but at the same time, you invest into yourself, you invest into your patients, you know that the patients will take their medications, do what they're supposed to do, stay out of the hospital. That's my goal. You know, no one wants to stay in the hospital.
Yeah.
Sorry, I know
No, of
that
course.
that's where I work, but
yes,
at the
but
same time, I want
that's right.
my goal is health, right? So I want to make sure that the patients are taken care of, that they're taking their medications, that they understand what's going on with their body. And so education is provided by myself on the medications, the diet, the exercises, like we talked about, what a Mediterranean diet is, what the exercises that are required or that are recommended, and trying to figure out what's going on. If a patient comes in with blood pressure, for example, or high blood pressure, depending on what the blood pressure is, I wouldn't necessarily put the patient on a blood pressure medications right away. I would have them take a look at their blood pressure at home, see what it is, record it at home, have them come back, and then let's go over the numbers. Let's see what the numbers are. If you need blood pressure medications, then we'll address that. If this is something where your blood pressure is actually pretty well controlled, maybe you don't need blood pressure medications, unless the blood pressure is really high. That's the only time that I would put them on medications right away. Same thing with cholesterol. Anytime a patient comes in for high cholesterol first time that I'm seeing them, unless the cholesterol is very high, I would try diet and exercise for 3 months and then recheck it. If it hasn't improved, then I'll say, hey, listen, you might need a little bit of assistance here. Let's put you on these cholesterol medications to decrease, again, your risk of coronary artery disease, to decrease your risk of a stroke.
So when people are taking the medication, they better continue to take it unless, of course, they meet with you, because there are people, you know, who decide not to take their medication, which is so foolish, isn't it? What's the danger of that?
Well, so what happens is, and unfortunately there have been a lot of patients that may mistakenly think that, okay, I finished my pills of bottle, or my bottles of pills, I don't have to take it anymore, like an antibiotic, but unfortunately it doesn't work like that. You see, for example, let's talk about hypertension, because we were talking about it before. Hypertension, if the blood pressure is not controlled, it causes structural changes in the heart. The actual structure of the heart changes.
Appreciate that. You know, a lot of, as you said before, a lot of doctors just, they don't like to take the time, or they don't have the time. But I get the feeling when people come to you, you really, you're their mentor. You call it teacher. I didn't know that doctors, that you could use the word doctor, teacher. Is that is that known as it's the first time I ever heard that?
Yeah. It's a Latin. Doctors come from doctor comes from Latin, meaning teacher.
I didn't know that. Well, that's good. But I think that shows your dedication, because it's really important for someone to feel that they can communicate with their doctor.
Absolutely.
Because you've heard that now.
Absolutely.
You know, that a lot of doctors aren't doing that. But one thing I have heard, of course, and know so many of the doctors at Broward Health North and the others, Bureau Point, that they are very special. You know, that who's ever choosing the wonderful doctors, know that that's important to the patient. And I mean, you see, and I happen to be a gerontologist, and I know that an elder person, you may notice that when they come to see you, they're all dressed up, everything's fine, and when you ask them how they're doing, the first thing they say is, I'm fine, right? Mm-hmm. At home, though, with their family, they're not fine. Mm-hmm. But it's something they want to impress the doctor. Mm-hmm. You know, you're the saint, the God, I'm sorry to say that, but that's the way it goes. And so it's so nice that you recognize, you know, who you are and what you can do to help them. And
Absolutely.
I'm sure you hold their hand. I can just tell about you.
Definitely. It's not just it's not only just a service. You know, I'm a provider for the patient. The patient's the person that's going to guide me on what they need to be helped. Okay, whether it be talking, or whether it be listening, or whether it be educating, or medication adjustments. Whatever they need, they're really telling me. I'm not, and no physician's there to dictate, all right, this is what you need to do. It's at the end of the day, it's your body. It's your decision about how you want to do things. My purpose is to educate, to let you guys know, or let the patients know what's going on, what can we do to fix it. And I'm very grateful for the profession that I'm in, and very grateful for being able to work at North Broward and the people that I'm surrounded with and the patient population that I have, you know, it's a great area here.
And so help me again, because I don't want to mispronounce. So it's Sheikh?
Sheikh, yeah.
Sheikh, I did it. Oh, that's good. So Dr. Sheikh. So Dr. Sheikh, if someone wants to come and have you as their cardiologist, even if they don't go to the hospital because they have a need, do you have a private practice that people can
I do,
come
yeah.
to you also? And then you work, you're affiliated with Broward
That's
North,
right.
but you do have a private practice. So
That's right.
at this point, why don't you give me so I have an office number. Is it the 702 number? Why don't you tell me what I'm sorry, that's a different thing.
Yeah.
Why don't we have a number that somebody can call you
Sure.
if they would like to set up some sort of an appointment?
Sure, let me get that for you.
Okay, that would be wonderful. And you're located, I have to assume, are you located in Fort Lauderdale or Pompano Beach?
So it's actually attached to North Broward Hospital. So it's 1 West Sample Road.
Oh, great.
And I think it's Suite 204.
Okay, that's all right. But what's your phone number? Because they're going to call for an appointment anyway if they want to have you.
Phone number is 954-785-0300.
Okay, so they can call there and they can set up an appointment with you, which would be a wonderful thing, because that's our listeners. They do that. They attach themselves to someone they heard, and they'll tell a friend, "Oh, I heard this doctor and he sounded so wonderful," and so they want to do that with you.
Of course, it'd be my pleasure.
When you were talking before, though, about their different degrees of people and what their heart is, is it simple? Is it more involved? And do you have to give them tests when they first come in, or do you pretty much know where you have to send them if it's not just a cardiologist they need?
Sure, yeah. Well, first of all, like I said before, the patient really tells me first what the issue is. I don't assume. If a patient comes in for chest pain, you got to talk and listen to the patient. What type of chest pain is it? Where is it located? What makes it better? What makes it worse? How long does it last for? They say you get about 70% of your diagnosis through a physical exam and history. So talking to the patient, listening to the patient, not just what they say, but actually listening to them with your stethoscope, you're already kind of coming up with a diagnosis. There have been times where a patient would come into the office and I'll say, "Hey, listen, based off of what you're telling me, everything's okay. Your heart's fine." But there are times where, we do need to order the extra study, that we do need to look into deeper. And if that needs to happen, then we do that, yeah.
And before we finish, just one more question that I've always had a burning inquiry about this.
Sure.
When they say family history, why is that important? I mean, because of the genes?
Yeah.
Okay.
Yeah, absolutely. And as how we started, family history is a big component of it. The genetic component is a big risk factor. If there is early coronary artery disease or heart failure or stroke, there is an association with it being passed down to family.
So that's why it's funny. Family history is very important, but a lot of people don't know what their family's history is because they either never asked. Years ago, people went to doctors, they never told their family.
Absolutely.
So it's hard sometimes for someone to know, in fact, someone asked me if anyone in my family had cancer. I said, no, nobody did. And then I was into my photographs and I said, "Oh, my grandfather died of throat cancer," and I had totally forgotten that.
Yeah, no, and I'm guilty of that too. I mean, especially when you have a big family like I do, it's kind of hard to remember who's got what,
Right.
But
yeah, well, so it's almost like a puzzle. Someone comes in, and that's your puzzle piece. And you're going to see who this person is. And also, I always suggest that when someone's an older person, they bring someone with them, family member, right? Somebody that, because they're not always going to get things exactly right, because they're nervous. First of all, you don't look like you make people nervous, but you will, because you're this famous guy. That's what happens. But people should, when they make an appointment, I think they should bring someone with them.
I think that's a good idea. Two things: if they need assistance, if they're not good with their doctor follow-ups and things like that, have a family member. There are times that if the patient gives me permission, I will talk to the family member over the phone if they're not able to make it. But also importantly, this is general, not just cardiac, but it's always a good idea, especially if you're seeing the doctor for the first time, make sure you bring your medications. Or if you don't have it written down in your wallet or in your purse, bring your pill so they can see
Right.
what medications you're actually taking, what medications you run out of, because you may not know the name of the medication or the doses.
That's right, and I'm glad you brought that up, and maybe we'll have you back another time, because people should carry their medication list in their purse or in their wallet with them, because if something happens, people need to know.
Absolutely.
Okay, well, this is great. I'm so glad to have met you. Thank you, Dr. Sheikh. And
Thank you so much for having me.
I wish you a lot of luck. Yeah, we'll be talking to you again, I'm sure.
That
Our
would be
little
lovely.
famous cardiologist here.
Well, thank you guys so much for having me.
Yeah, it was a great pleasure. Thank you.